If, as the government likes to describe, this is a race between the vaccine and the virus, then obviously we want the vaccine to win. And tonight the Prime Minister said a 4-week delay in ending restrictions in England to July the 19th will be enough time to gain some advantage.
We've obviously faced a very difficult choice. We can simply keep going with all of step 4 on June the 21st, even though there is a real possibility that the virus will outrun the vaccines and that thousands more deaths would ensue that could otherwise have been avoided. Or else, we can give the NHS a few more crucial weeks to get those remaining jabs into the arms of those who need them.
There was no surprise in the announcement. It had been widely briefed over the weekend. But today the Prime Minister confirmed the 4 tests to unlocking have not all been met. The first 2, pace of the vaccination programme and their effectiveness, are going well. In fact, new analysis tonight shows the Pfizer vaccine is 96% effective against hospitalisation after 2 doses, and it's 92% for AstraZeneca, all against the Delta variant, first identified in India. But the 3rd and 4th tests, pressure on the NHS and the risk of any new variants have not been met.
There has been a 61% increase in hospitalisations since last week in the northwest and a 50% increase across the country as a whole, but we expect that will probably accelerate. So there is the hospitalisations are following, but with a delay, the number of cases. So although we do not think an immediate overwhelming of the NHS is likely, if this continues on an exponential path, and in particular, if that then accelerated further due to further loosenings, then we would run into trouble.
There is much uncertainty in the modelling, but comparing January the 8th with the most recent figures, we can see that on that day, there were just under 62,000 new infections. Yesterday, there were just under 8,000, with current doubling time at about a week. Though that means we could be back to the same infection levels by the first week of July. Hospital admissions are low, 187 on June the 8th, but they are expected to also double about every week. The difference this time, though, is that 60% of people in hospital are aged between 30 and 50. Reaction to today's news has been decidedly mixed.
We was half expecting it. We were hoping it weren't going to be because our holiday's been cancelled 4 times now.
I feel like a lot of the time things were promised and it wasn't followed through.
I'm kind of okay about it if it means that the people are a bit more safe as a result.
Modelling by 2 academic groups shows a wide range of scenarios, but they both agree a 4-week delay could reduce the peak in hospital admissions by around 1/3 to 1/2. It is, however, a perhaps obvious fact that as people have more social contact, the more the virus will transmit. The uncertainty is how much people's behaviour will change. There are those too who warn that a reliance on lockdowns and vaccinations is too simplistic.
Now 16 months into the pandemic, we don't have a functioning test, trace and isolate system that is working. We know that only 1 in 5 people with symptoms are coming forward for testing, and even symptomatic people, only half of them are isolating. So overall, we're not breaking most of the chains of transmission that are happening. The second thing we've never managed to do is focus on controlling aerosol transmission in schools and workplaces and indoor buildings. We've never invested in mass ventilation infrastructure in those buildings, and we're seeing a lot of transmission in schools as a result.
The Delta variant is anywhere between 30 and 80% more transmissible than the Alpha or Kent variant, and it now accounts for at least 90% of all cases. The scientists, though, have asked for and received more time to analyse the data. And from tomorrow, 18 to 24-year-olds will be able to book a vaccination.